It is 12:03. Phone lines wide open, 416-870-6400, star 640 on cell. Dr. Payne Show set for another Saturday afternoon till 1 o'clock today. Pain concerns, bring them on. We're going to talk about a lot of stuff today. Lower back, neck, shoulders, headaches. It's all part of being human.
Yes, it is.
And walking on 2 feet. It's the price you pay for being a bipedal life form.
That's right.
Week that was, we always get to something that was happening, some interesting stuff, cool stuff in the clinic this past week or so. What's going on, pal?
Yeah, this week actually was not overly busy with any overly interesting cases, actually. So there's not much to highlight, and I usually try to keep you guys informed on everything that, so either people are getting better or whatever. But, again, I think we should probably go a little bit old school with this show and just concentrate on the stuff that affects people most, the neck pain, the low back pain, shoulder pain, hip pain, foot pain, those types of things. And that's really the majority of the types of when we do the week that was, I often give you the most interesting clinical case. The vast majority of everything that's being seen is that mundane mechanical neck, lower back pain that just hasn't been dealt with the right way. If we take, for example, neck pain, it's not uncommon for me to see someone that says, I have neck pain. It's been going on for a long time, often related to some type of vocational thing, whether it's them sitting at a desk or they're very active. Usually the desk stuff is actually a little bit worse for the neck pain stuff. And so, you see this type of person says they've got neck pain, been going on for a long period of time, have had lots of different types of treatment, not uncommon. And we've heard callers call in, say, well, I've already done the physio, I've done chiro, I get massage, I do this, I do that, but I'm not getting better. The one thing that I consistently find that's missing is these people have failed to rehabilitate their neck. And, again, the big thing that I often will have a conversation about with every single patient that comes through the door is this idea that your pain needs to be cured. Once it's been going on for a very, very long time, it's hard to ever get it to go away completely. And we've gone through this ad nauseum. What you're actually trying to do in those instances is called pain management. Pain management means let's get your pain to a level that it doesn't bother you day to day. Yes, maybe it may get exacerbated due to certain things, but day to day, you're going to be fine. It's not going to be influencing your life. And then when it does get exacerbated, you're going to know the right things to do, whether it's the home exercises you've been shown or the home active program, or that this is the time that I go see a professional for some of that more passive intervention, the modality type of treatment, or the manual therapy or the physical therapy, whatever it may be. But one thing that people, and the other thing is people say, well, no, I haven't really done any of the rehab stuff. That doesn't always necessarily mean they haven't been shown that stuff. It just means that they've maybe been a little bit lazy and they don't do it. And we've talked about this, that it's not something that you can say, okay, I'm going to do this and I'm only going to do it for a week, and then if it doesn't work, then leave it.
I'm going to bail on it.
No, it's the same analogy that I use when someone is obese and they're trying to get to a healthy weight. It's lifestyle management at that point, because that person, if they just go on a diet and they achieve their ideal weight, once you stop that diet, you have the potential of going back to where you were. Well, pain management is the same. If you've used the rehabilitation program to get you better, but then all of a sudden you totally cut it out of your life, it's not going to be unlikely that you go back to exactly where you started. And so a lot of what we see with neck and lower back pain especially is that there's a loss of endurance with the muscles that support that area. Because if you were to look at a skeleton right now, and we've all kind of seen the skeleton model, the neck and the low back are very different from the thoracic spine, the mid-back, because the mid-back has the ribs. And so it provides an inherent amount of stability. And really it's that lack of stability. And there's a difference between a true clinical instability where something is unstable and can potentially be very serious versus kind of just muscular weakness that leads to a little bit more motion in those areas than you would commonly expect. And it's that type of extra movement in the neck and the low back that really creates that long-term chronic pain type of syndrome that happens with people. So the key is I'm not saying that it's only rehabilitation. Everything has its part, whether some people may benefit a little bit more from medication, other people benefit more from, active types of therapies, such as the rehabilitation. Some people do very well with the passive type of interventions like physical therapy or chiropractic or massage therapy. And it's really about someone who's knowledgeable in this, looking at you, understanding the constellation of signs and symptoms that you're presenting with, and being able to say, you know what, based on everything that I'm seeing, you're a good candidate for this. Now, that doesn't mean that every single person with low back pain responds to, for example, physiotherapy treatment. But that also doesn't mean that, one thing that I often will hear is someone comes in with low back pain and says, one of my family members was here to see one of your associates, right, one of the chiropractors or one of the physios, whatever. Let's just use chiropractic as for this one. And says, they had treatment with the chiropractor and they felt great, and I want that same thing. And the first thing I'll say is, okay, that's great. I'm happy you're here. But you can't assume that chiropractic treatment is what you need right now. And you can't also assume that just because their back pain benefited from that, yours will as well. Maybe it will. I'm not saying it won't. But pain is pain. And what we need to do is we need to figure out, is your pain the exact same cause as that person's pain? And are your prognostic profiles, the way you guys are presenting, overall the same? And then, yes, maybe we can say that, yes, that similar type of intervention will help. But if that's not the case, then it may not help. So it's always very dangerous, because people will talk to their family members and they'll say, oh, I had knee pain. And they say, I have knee pain now. And again, they haven't specified what the cause of the knee pain is. And one person will say, I went and got such and such treatment and it worked. And then they go there with the expectation that this should work in the same amount of time, in the exact same way. And that's not always necessarily the case. And then these people get discouraged. And that's a very dangerous thing. It's that discouragement, because once you start to believe that your pain is not going to get better, that's when you start to introduce that chronicity that we've talked about. Once you start actively involving your mind in this isn't going to get better, that's when chronic things start to rear their head. And that's where the psychosocial, that mental component of pain starts to come in. So it's very, very important that you let the professionals deal with this stuff, and you let a professional take a look at it and determine what is the best course of action for you specifically. And I think that's, not to toot my own horn, but I feel that's what I'm trying to do different. I'm not looking at everyone and saying, here's the exact same thing. Some people, I will have them stay within my clinic or within my provider of clinics. But a lot of the times I'm looking at people and saying, you don't need any treatment. Here's exercises that you got to do. I'm trying to be brutally honest and design a treatment program for people that helps them get better. That's not really specific to any other confounding variable, such as me saying, well, I want you to stay in the clinic because that equals more money. If, again, I'm not saying that, we don't want to make money, but my first goal is making sure that the patients get what they need. And so that's what I feel my assessments really do, is that's the difference. There should be no preconceived notion. You're simply coming in for an assessment. The real point of that assessment is, let me figure out what's going on and let me recommend something, a treatment plan that I believe is going to be tailored towards you, specific for you, and will help you. And yes, sometimes that involves treatment. Sometimes it may involve a referral back to the family doctor to get other people involved. Sometimes it's just exercises. Sometimes it's diet modification. It could be any host of things, but the key is it's individual. And then I ask people, you've been told other things by other people. Right. Let's just put those off to the side right now. Try this plan for a period of time, because that's another dangerous thing when you have a bunch of healthcare professionals not necessarily working together and all telling you different things. You create a tug of war.
Get on your way to that free assessment, by the way, or at least the assessment with the free consultation. That 1-855-55-Dr. Lou, DRLO. Your phone calls, bring them on. We want to hear from you. You're suffering from pain. You got health questions in general. Dr. Payne Show right here till 1 o'clock, 416-870-6400, star 640. On your cell. Dr. Payne Show continues. Talk Radio, AM 640. 416-870-6400, star 640 on cell. You got pain, chronic, anywhere you got some health concerns, bring them on. We'd love to hear from you this afternoon till 1 o'clock is when we're here. Dr. Payne is here answering all your questions. DRLOU.
Or the
Dr.
info at Pain Care Canada. Yep. I actually just got an email, except The question was, why is the intro music changed to your show?
That's that explanation's far too long and too technical that you'd even care about. Trust me.
We're trying to change things up. Let's just leave it at that.
It's funny you mentioned that someone coming and saying, my buddy came here, or my wife, my daughter, they got their back fixed. I want the same treatment. It'll work the same. It's like, I don't go home saying, Dr. Lou, here's what I ate for dinner. That's what you should eat for dinner, and you'll love it.
It needs to be specific for sure. And a lot of times people are not doctors. Not the average person is not a doctor. So they just assume that low back pain is always caused by the exact same thing. Yeah. And maybe they're not knowledgeable in understanding that, But that's fine. I'm not saying that the general public needs to change. The unfortunate part is other people refer to other clinics with that mentality. And instead of having the conversation with people saying, hey, listen, it's all about education and empowerment when it comes to healthcare. And that's the biggest thing. You need to educate people right away, because letting them know that, hey, that's not necessarily the way this works. Your pain may be due to a different cause than your friend or your mom or your sister's pain. And so we need to look at this and figure it out. That already right off the bat improves that person's prognosis, because now they're a little bit more knowledgeable. They understand, okay, well, I guess pain can be caused from different things. It sounds like this person is going to try to figure out what specifically is causing my pain or my health issue. And that's the important part. That's what we need to figure out in the office, is what's causing your issue.
416-870-6400 star 640 on Cell. Jeannie, hello. Good afternoon.
Hi there.
How are you?
I'm well, thank you very much.
Good. Go ahead.
Okay, my medical issue is that I have Morton's neuroma, and I've been seeing a podiatrist for the last 9 months. So started off with a new running shoes, a new pair of orthotics, and in the 9 months I've had the orthotics adjusted twice, and he gave me injections my first couple of visits, and then he gave me more injections again last week because I wasn't feeling any change whatsoever.
Right.
So I'm sort of like in a dilemma. What do I do? And like I said, it's approximately 10 months that I've been seeing him and going through these procedures, but I just don't see any relief in sight, and I just don't know how to move forward.
Right. And so just for people that are listening that don't necessarily know what a Morton's neuroma is, that's when the nerves that are within the feet get compressed and it causes a bit of an inflammation in that nerve, and it creates nerve type of pain. Is that the type of pain you're having, Jeannie?
Yes, correct.
And so the biggest thing with a Morton's neuroma is trying to relieve the pressure off that nerve, because it's that pressure on that nerve that's creating that constellation of symptoms.
Right.
What also needs to be assessed, so here's the issue. Whenever someone has numbness and tingling in one area, let's say like your issue, Jeannie, let's pick the foot.
Yes.
And you see someone who's, and again, this is nothing against that specific podiatrist that you're seeing, and I may be wrong. I'm just going to make some assumptions right now. They may only be looking at the foot as the potential cause of that type of nerve pain. But the reality is the nerve goes all the way up into your back. And in fact, you have a spinal cord and a brain that can all create nerve type of pain. So what needs to happen usually in this type of instance is, if someone came to me and said, hey, I have pain in my left foot, there's numbness and tingling in my toes, there's some very easy tests that can be done physically to determine if it's a Morton's neuroma. You can treat it like a Morton's neuroma, but after a period of time of it not improving, that's when you have to go back to your differential diagnosis. Differential diagnosis is how many other things could cause this constellation of signs and symptoms. You have to go back to that and say, okay, let's take a step back here. Could this be a peripheral entrapment maybe somewhere in the calf? Could there be a tight muscle in the calf that's referring that pain? Could it be a peripheral entrapment a little bit higher towards the glute? Could this person maybe have a disc herniation? Could this person have a cyst within the spinal cord? And in very, very rare cases, could it be even something more, a neurodegenerative disease or something, which is very unlikely, Jeannie. I'm just giving you my diagnostic process. So my best recommendation for you at this point is if all you've been focusing on is the foot and you've been doing the possible, we would have to go look at it and have that. This is the example of the consultation, just for anybody that's listening. You tell me an issue, and then I tell you, is this something that I think that I can assess and find a better way to potentially treat or manage? And we would have to go through a full assessment just to see, okay, exactly what interventions have been done, how many times have they been done, what are you doing day to day? Because another issue with the foot is you use your foot every day. So, usually when people have shoulder injuries, for example, they can limit how much they use that shoulder, because it's not that it's not essential, but you could say, well, I'm going to use my other shoulder, and I'm not going to raise this one above my head, versus the foot is, well, I have to walk, and even walking can put pressure on that nerve and create a problem. So So we need to look at it, assess, okay, what are all the possible things that you have currently done? Is there anything else left in that realm of treating a Morton's neuroma that could be tried that could potentially help? And also, again, looking at, is there a nerve issue coming from somewhere else that you're just simply feeling in the foot that's mimicking Morton's neuroma symptom? And so that's very important, is trying to distinguish, could there be more differential diagnostic things that are creating that type of symptom? And it may not be. It may just sometimes, again, things become chronic and they're much harder to treat, and there's other components that need to be looked at. But I do find when it comes to extremity situations, we've heard this a lot, and we've actually had calls about carpal tunnel, which is not all that different from a Morton's neuroma. It's just pressure on a nerve in a different place. And how many times people have presented to me with what they've been told is carpal tunnel.
Or been through surgery even.
Or been, we've heard that story live by someone who called. Or have been through surgery, and it's not actually carpal tunnel. It's entrapment of the nerve somewhere else, creating a similar type of symptom. So I would say, Jeannie, if you can, give us a call. Let's try to set up an assessment and see, could this be due to something else?
Jeannie, 1-855-855 Lou, 1-855-55-DRLOU. That's all you got to remember. info@paincarecanada.com. We'll be back. More of your phone calls, 416-870-6400, star 640 on cell. That's what we do here. That type of analysis right to 1 o'clock. Dr. Payne Show, Talk Radio, AM 640. At 12:22, 416-870-6400, star 640 on cell. Your calls. Got lots of open lines. Would love to talk to you this afternoon. James, good afternoon, pal.
Good afternoon. How are you?
Good, man. What's your concern?
I'm calling on behalf of my girlfriend. I love the woman dearly, but she's been suffering with neck and head pain for years. So I've been after her to kind of get this looked after. So I was wondering if Dr. Lou could tell us, because we've gone to different doctors, family doctor, a chiropractor recommended by a friend, another doctor, and we all, like he was just talking about a tug of war. Mm-hmm. We always seem to have a tug of war.
Yeah.
So I'm wondering, what branch of medicine or what type of doctor should you see to begin the process
Excellent call.
Neck and head pain?
Sure. Great question. The one thing that I will always say, that I'll always preface with, is that it usually is not related to necessarily the profession as much as it's related to the individual. Let's just start by saying that, because there's some specialists out there that are not, that, you should never
not
listen
that special.
Not that special, exactly. But there's other specialists that are incredibly amazing and know everything. And there's some family doctors that are incredibly well-versed in neck and back pain. And then there's others that know very little about it. And there's some chiropractors that are incredible. And then there's others that maybe don't, focus so much on the diagnosis as much as they do on the treatment. So I'll preface it by saying that it's usually more important that it's related to the individual. Is there someone that you know of that you can trust? Which that's why I'm trying to do what I'm doing, so that maybe hopefully I can build that trust with people. And when you're thinking of that question, you're thinking, okay, Dr. Lou's the guy that I should go see. So I would say that, that's a biased first answer. But in general, let's take, for example, chiropractic. They're really trying to push chiropractic towards becoming the non-surgical spine specialist of the healthcare world. So I would say, if I had to, just pick one off the top of my head, I would maybe say that one. But again, it's not as easy and clear cut as that, because you may be going to see somebody who's not very good, who doesn't have all the tools at their disposal to differentially diagnose this stuff. So again, the thing that I'm trying to do here is I'm trying to also build a provider network of people that I trust. So, we can talk off air. You can give me a call. We can talk a little bit more about exactly what's going on with your girlfriend, or you could tell us now. And then, if it's a matter that, coming to see me specifically maybe is not really convenient or whatever, I can definitely help point you in the direction of someone that would be good for this. But it's a very loaded type of question to just have a clear-cut answer to say, this profession is the best at this type of stuff. It really, really does depend. In my experience so far, in my experience in the healthcare world and working in it, it really depends on the individual, because, again, some surgeons are great and some are not, and some physios are great and some are not, and that's always the harder thing. So I try to be a little bit apprehensive of saying just go to this profession, because that's not really the way it should work. And in fact, a good I think healthcare professional will have a team around him or her so that way they can co-manage this type of issue that maybe isn't clear-cut within the definition of just one type of specialty.
Right, yeah, agreed. Okay, I appreciate that.
No problem.
Did you, her pain is, she's been rear-ended in a couple of car accidents. I mean, I don't want to take up too much of your time. I know you got other
No, callers. It's okay.
And she works in front of a computer, so she's hunched over.
Right, yeah.
Yeah, we
so,
talked about that.
And so what has she been told is wrong with her?
Oh, this is where, like you were just saying, you go to one doctor, we didn't see anything in the x-rays, just do some stretches. You go to a chiropractor and he'll manipulate, but there's really no clear direction or where does this end or what's the goal? Yeah. Where are we heading with this?
So usually, so just generally based on that quick history, and by no means of what I'm about to say, am I saying something that's diagnostic because I don't know, but it's not uncommon I see lots of people who were in some type of traumatic accident, whether it be a car accident, a work accident, whatever, and then they also have some vocational type of work that does their things. This is where that multimodal approach, where maybe your girlfriend should be doing manipulation with a chiropractor, but also doing stretches at home, but also doing something else. That's where the combination is very, very important. And again, this is kind of where I tell people, if you're going to an individual, let's say you're referred to a massage therapist, and that massage therapist is in an office by themselves, well, likely they're going to tell you that massage therapy is part of the answer because there's some type of financial gain in doing so, similar to a surgeon. The surgeon is going to get paid by, you doing surgery with them, or a family doctor is going to get paid by the fact that you repeat to go back to say, hey, this still isn't better. What should I do next? So that's where that team environment is very, very important. Right. And where if maybe you can eliminate those secondary gain things from a professional standpoint. And again, I'm not saying this has been the case with you, that the people you've seen, that's their reason. I'm just thinking out loud that sometimes it's these types of things that really hinder a person's way to get better. Also, once things become chronic, maybe there's a psychosocial component where there's a mental issue that needs to be dealt with as well from maybe a social worker perspective or a psychologist perspective. It's so multimodal that's why the assessment and the treatment recommendation need to be specific. And in all honesty, I find that most of my recommendations, it's never a recommendation of here's one thing that you can do. It's usually a bunch of things of here you can do. It's the same as losing weight, right? If someone said, how do I lose weight? You wouldn't just simply say, don't drink pop. It would be don't drink pop, eat lots of green vegetables, exercise, et cetera, et cetera. There's multiple factors that usually lead to success in that realm.
Moving forward, James, 1-855-55 Dr. Lou, DRLOU. We'll get to another quick one before we break. Chase, hello.
Hey, how are you, sir?
Good. What's going on with you?
Not much. So basically, I got hurt about 10 years ago, and it was a work-related incident. So my doctor had me on narcotics and whatnot, and everything was going pretty good for a couple of years. My pain was at a level where I was comfortable and it was manageable. And then what had happened is I kind of developed a substance abuse problem with the medication she was giving me, and I, confided in her. I was honest. So now I'm at a point where no doctor wants to help me. I do have a documented case of complex regional pain syndrome.
Yep.
So now I'm at the place where I'm kind of forced to, I have no way of getting any help for my chronic pain, right? So now I went to a specialist. So my doctor said she needed someone else to kind of govern it too. So I went to a specialist at the Wassermans, and he sent me back to my family doctor. So, and my family doctor basically said she still needs more, I guess, documentation from somebody. Like, if she doesn't feel comfortable prescribing it, right?
Okay.
So what does that leave me? I guess someone who's, I had a problem with substance abuse, but I still am a chronic pain patient. So where does that leave me? Like, no doctor wants to help me.
Sure.
Right?
And your story is not actually that uncommon with what's happening with the opioid crisis and the restrictions around it, where we actually talked about this last week that people such as yourself that were given that as the only option maybe towards their pain, which maybe it was wrong in the beginning. Like there should have been maybe better things that should have been recommended to you that you could have done so that you didn't create that problem. But, we're not going to focus on the past. The reality is, like you said, you developed that problem, that addiction. And so now you're being taken away from that stuff and you're being sent around. And most physicians and healthcare professionals now have their hands tied in this. And so what I've basically said to people such as your condition, because I have people call me all the time hoping that I can be the one that helps them with this. And the reality is, when it comes to this type of issue, if you've been taken off your medication, especially an opiate or a narcotic, and no one wants to prescribe it to you, I'm not going to be any different, and my team is no different. We work within the same legal ramifications as everybody else. So what I've said to people is this is where this is not really as much a healthcare issue as it is a political issue. Get on the phone with your local MPP and let them hear your story, because they're the ones that need to make the appropriate changes from a legislative standpoint in order to change this type of issue going forward. And I agree that maybe we should be stopping people from creating new addiction issues right now. But people such as Chase that we have on the phone right now had a problem created, and to just eliminate it is potentially a dangerous thing. And again, I'm not saying that I know everything about this, but the one thing I can tell you is get on your phone with your local MPP if this is an issue you're suffering from.
Info@paincarecanada.com, 1-855-55 Lou to get a hold of Dr. Lou. But for now, until the end of the show for another half hour, 416-870-6400, star 640 on cell. Would love to talk to you. More of the Dr. Payne Show coming right up. Talk Radio, AM 640. 12:33, lots of time to call. I saw Harry there. I didn't hang up on Harry.
Now I got my wife messaging me about the music, saying it sounds so infomercial-like. Leave the music alone.
There's a reason.
Focus on the content of the show.
Never mind. Play your own music. A little Zeppelin in the background. Whatever you want. 416-870-6400, star 640 on cell. We've had a couple calls talking about, I was directed to go here and there in chiropractic. And back when I used to go to a chiropractor, they were manipulators. That's all they really did. That's not the way anymore. And the multi-pronged approach is the way to go, right?
And again, I'm a chiropractor by trade myself. And what I'm doing is pain assessments. And the manipulation standpoint of chiropractic treatment is just one point. There's so many other things that can be done. Are there still people out there that are traditional chiropractors that just manipulate? Yes. And maybe that's the answer for you. Go have it. This is where anytime you meet a healthcare professional, whether it's a dentist or a chiropractor or an optometrist, what they're saying and what you're feeling needs to jive. If you are somewhere and you feel like, I'm not really buying what this person's saying to me, or I don't really this doesn't really align with my set of beliefs or whatever, then that's a red flag right there. That just means maybe that's not the right place. But sometimes people, I know friends of mine that are chiropractors that are just strictly manipulators, and that's all they do. And they have a patient base, and that patient base benefits tremendously from what they're doing. So if that's the case, that's great. But I think it's the job of both the practitioner and the patient to make sure that they're aligning with each other. And if one believes that they're not aligning, it's both of their responsibility, because sometimes you may have the practitioner say, like, listen, maybe what you wanted out of these treatments isn't something that I can provide. I'll refer you to someone else. Or the patient needs to say, hey, this isn't what I was looking for. I'm going to go somewhere else, or can you help me find somewhere else? So honesty is really the best policy.
I think the patient part of that is really key, because we'll find people will shop around to 4 or 5 different car dealerships for the car to get the right car, but then they'll stop at one practitioner.
Correct.
Didn't work. Don't know where to go.
Yeah, exactly. And also another sad thing is that oftentimes if you have a bad experience with one practitioner, you then tend to kind of crucify the whole profession.
Right.
And maybe chiropractors unfortunately have the worst, where someone sees one that they weren't so happy with, and that's it. Every chiropractor out there is horrible. And that's not really the case. And that's analogous with what you just said with the car dealership. If you went to one car dealership and you had a bad experience, you would never say, I'm never buying a car again, right?
Yeah.
They're still going to judge people based on that individual, not necessarily the profession, because all of these professions, chiropractic, physiotherapy, massage therapy, medicine, occupational therapy, whatever, the list goes on, they all have a place, and they're all doing tremendous things for the overall healthcare system.
416-870-6400, star 640 on cell. Again, info@paincarecanada.com. You'll want to email Dr. Lou after the show. You can do that anytime you wish. Again, the focus, lower back and neck, still so prevalent with people in this day and age. Not that we've physically changed over 10,000 years, but it's still a lot of problems, right?
No, and I mean, with what we're doing, especially the sitting, the majority, there's some new research coming out saying that sitting is analogous to the new smoking.
Yeah.
So, when we realized that smoking was like this horrible thing and it basically made everything potentially worse, we're starting to realize that sitting is just as bad. And so getting up and moving around as much as you possibly can throughout the day is extremely important, because it's that analogy that sitting is becoming the new smoking, and we need to be to move around. Our bodies are very, very much designed for that dynamic movement. I was explaining to a patient this week, they have a little bit of stenosis going on, and so in their lower back. So what they have is they have lower leg symptoms, so they're unable to walk. But he knew about that. He didn't necessarily come to see me for that. What he came to see me is he's now developing low back pain. And I was basically able to figure out your low back pain is just simply due to your lack of movement. The majority of our joints in our body are what are called synovial joints, which means that they get the synovium, which is the fluid that lubricates them, is the fluid that brings nutrients to the joints and takes away waste. The only way that fluid is secreted is through movement. And so, that was kind of the problem. And now for him, it's a double-edged sword. I was able to offer him solutions on how he could move without aggravating his stenosis, which is why you see a professional. But it's very, very important. I even had another patient this week that had neck pain, just mechanical neck pain. And I think the family doctor, told him, go get a neck brace. Like, a neck brace should only be used in an instance where there's an instability, where a movement could leave you paralyzed. Okay?
You want the movement, no?
100%. In fact, 30 years ago, the common prescription for low back pain was stay at home and rest and lay in bed. And we were able to figure out that actually makes you much worse because of that whole synovial joint. There's no movement. You start to stiffen up. If you're being told to go get a neck brace, that's potentially the wrong person that you're seeing that doesn't understand mechanical pain, that how much things have changed in the last 30 years. So, just be careful with that type of stuff. And movement is very, very important.
Good afternoon, Mary. Hello.
Hello, doctor?
Yes.
Okay. I had a fall at one time, and then I got hurt badly, and I had a rotator cuff tear.
Okay.
And it was so bad the doctor wouldn't operate on that because he said the muscle was torn. He couldn't operate.
Okay.
So from that, now I've got, I think it's carpal tunnel, because my arm and my hands are so numb and so painful every night at 2 o'clock. It wakes me up that I don't know how to put myself with such horrible pain.
Okay.
So I don't know. I'm supposed to see a doctor in November now. This is the third doctor. I'm going from one to the other, and I'm always waiting. And I'm just in such that I don't know what to do.
Okay, so this is a good example of with me and my team. There's not a long wait. Usually, if you call to see me for an assessment, I'll be able to see you usually within the next week, sometimes even before that, because all I do is assessments. I don't focus any of my time on treatment, other things. That's why I've built a team, so that way I can get people in quickly and at least point them in the right direction. So, if you've already seen multiple people and you're now waiting on someone else and that's a few months away and you'd like a quicker answer or a second opinion that's quicker than that, it's very simple. Just call 1-855-55.
Yep. 1-855, Mary. 1-855-55. Dr. Lou. DRLOU on your keypad.
Dr. Lou.
Yeah,
and hit option 1, and that will take you to the clinic where I do my assessments.
Okay.
Now, I do my assessments in Etobicoke, so this is one thing I just want to reiterate. I can't be everywhere, right? And I've got people calling from everywhere. So I do my first assessment. You'll have to come see me. It's in Etobicoke. However, after that point, if there's some consistent treatment that you need or someone that you need to see, the provider network that I have is all across Ontario, and I can help get you somewhere if you need consistent care or whatever it is that you may need. But the first step is to see me, and to see me, that's done in Etobicoke. And there is a $45 fee for the time component, but when you go through it and you see what you get out of that. $45 is nothing, right? Like $45. I've been told that I should be charging hundreds of dollars for this assessment. And I don't, because I just don't think it's realistic. And, there's good evidence, especially in the American system, to show that when people have to pay for something, they put more weight into it, right? Because
for sure,
when you just give a health card, it's kind of like, oh, this is free. And it's, there's a certain component, even with kids, like when you're trying to raise a kid, letting them give you $1 or something like that. It's very important. It shows that a transaction has happened and that you got something out of that. So it's a $45 fee. It's just really because I spend a lot of time with the people, but I believe it's very, very cheap and very, very well worth it.
Again, Mary, make that call, 1-855-55 Dr. Lou, DRLOU. And more of your phone calls. We got open lines, 416-870-6400, star 640 on sale. Dr. Payne Show. Trying to help. Talk Radio, AM 640. We got time. We got open lines, 416-870-6400, star 640 on cell. It's funny, you get to a lot of people that eventually by the time they call the show, they feel helpless. They don't know where to go. They've tried different things, and all of a sudden, like you said, the psychological kicks in, and then that's something else on top of the cake you got to deal with, right?
Sure, yeah. And I just got an email very similar to that, so let me just read it. Hi, Dr. Lou. I'm currently listening to your show. I have lower back pain, rib issues that have flared up after 2 years of being somewhat pain-free. I've fallen down the stairs and injured my ribs in 2011, broken, dislocated, separated, and been diagnosed with costochondritis before 2015, all related to injuries or falls, which I understand the flare-up. I'm going on 2 weeks of rib flare-up for no reason. I've seen my GP, physio, and osteopath. I'm getting different diagnoses for what is wrong with me or why this came. I'm in serious pain, and I don't know what is wrong with me. I've been off work for the last 4 days because sitting is unbearable. I also feel my ribs moving around. I'm getting the tug of war. Exactly. So just, again, highlighting everything is this is a big problem. Now, the other thing is, let's not just focus on the healthcare professionals that they're creating the tug of war. It's sometimes also the fault of the patient and not necessarily the person who just sent me this email, because again, I don't know them. But sometimes people just can't listen to one person. They start getting the anxiety about what's going on, and they need to get it reassured. And that's kind of a sign of a hypochondriac, and the anxiety is that you need constant reassurance from different professionals. And so sometimes it's also up to the patient to say, hey, I am seeing this person. I'm just going to focus on what this person is telling me right now. I'm going to give this, talk to the professional and say, how much time do you need with me? If that person says 3 months, you can maybe turn around and say, fine, you've got me for 3 months. And I'm going to focus on everything that you say for 3 months. But that tug of war is very, very dangerous. The other thing is sometimes is letting your healthcare professionals know that you're dealing with other people. Sometimes people don't want to tell them that they're also seeing that person or this person. But you know what? That's very, very important. If you can get a report created, if you start seeing me and then you're going to go see you, for example, John, I could just simply create a report, send it to John. John can look at it, see what I'm already doing. Exactly. But that it's so often missed in healthcare. And so this is the problem with why there's lots of reasons for the tug of war. Again, if you're having that struggle, you've been told something, need a second opinion. That's why I'm doing this. It's all very simple. It starts with just an easy phone call. If you hit option 2, you leave me a voicemail or send me an email at info@PainCare Canada with your issue. And I'm going to get in touch with you. I prefer to talk with people. I'll be honest. When people send me an email, I usually email them back saying, please send me your number. That way we can talk. It's my preferential way of communicating. And you can see with healthcare, there's too much back and forth, right? So for me to start sending an email to ask a question, get an answer, and then back and forth, I'd rather do that over a phone call. I'd rather talk to the person. So, if you're going to send an email, that's fine. Send an email, include your phone number. I'm going to prefer to call you to talk to you about this issue. And then from there, once we've talked about it, again, this is the radio show is an example of a consultation. I talk about it. Sometimes people call in with things that I say, hey, go back to your family doctor. We can't help with this, right? Sometimes people call and I say, you know what? You should come in to see us. That's the next step is the assessment. So if you've been listening to my show for a long period of time and you're confident that you know whatever it is something that I can likely help with because it's musculoskeletal or you've heard me talk about it, skip the consultation part. Just call, book the assessment, come in, come see me, and let's deal with the issue.
Because you can't gauge intent through email as well. So you'd actually have to talk to somebody, right?
Yeah, and some people just, sometimes it's a quick question like, hey, how much is the consultation? That's obviously an easy email to answer. Or, hey, where's the office located? Or, and even fine, people will send me the email with their story because sometimes for others it's just easier to document it that way. And it'll be easier to get the conversation going. But I will just simply email you back and say, can I have a phone number to call you at? That doesn't mean I'm unhappy that you sent me an email. It's just the way I'm going to want to communicate. And that email is nice because it gives me a concise story. So sometimes when people send me the emails, at least I already know what's going on and I can call them, give them my opinion, and then go from there.
How about, you've often recommended as well, if you haven't got a friend or family member who hasn't maybe, got off the rear end to make a call on their behalf, at least get that ball rolling, right?
100%. I think that's I think that is so important that if you have people and friends that are suffering, family, friends, whatever it is that are suffering with things, that you're listening to the show and thinking, you know what, I think Dr. Lou can help with this. I think you should do your best to try to get those people in. Now, obviously, they're going to have to be the ones that come in. But, a lot of people will call me and say, hey, I've got my mom and she doesn't know I'm calling you, but I think that blah, 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 blah. And I'll just simply say, you know what, talk to your mom and let her just know if it's going to be okay if I call her. Because I obviously don't want to intrude on people's privacy. And there does need to be, someone needs to be willing to want to talk to me. But that's all it is. If you have somebody, just tell them, you know what, just have a conversation with this guy on the phone. There's no commitment, no nothing. It's just a simple conversation. And maybe I can talk to them. I can enlighten them on something that they don't maybe realize or they don't know. And it could be the step towards changing their life. And we've heard these stories on the show that people's lives have been changed. And that doesn't necessarily mean that what I do and what my team does gets people from 0 to 100%. But a lot of times people are very realistic and they're just looking for 40% improvement or 70%, or they just want to be able to still play golf. And that's so important, is what is your realistic goal about your pain? Because to expect that it's going to be gone forever and never ever come back, that's just not real, and I'm never going to promise that to anybody.
Dr. Payne on social, info@paincarecanada.com. That is an email we keep talking about, and the number 1-855-55 Dr. Lou, DRLOU. Still got a few minutes here to call the actual radio station. Got some lines open at 870-6400 *640 on cell. Dr. Payne Show. It's Talk Radio, AM 640. That is the number. Get that assessment happening. Get the consultation at least. Phone Dr. Payne and figure it out. We'll get to Andrew on the line. Hi, Andrew. How are you?
I'm doing well, thanks. How are you?
Good. My screens here says exercising in sand. Please elaborate. What does that mean?
Well, it's a pretty easy concept. It's sand and exercise.
Okay, thanks for the call, Andrew. Have a good day. So how does it work?
Well, specifically, with reference to this show, it has to do more with easy movements and rehabilitative movements. That is all standing up. Mm-hmm. So squats and lunges and any variation of that, specifically to help people with joint issues, with muscular issues surrounding the joints, and neurological issues that are, of course, playing into both systems. Mm-hmm. So I just wanted to know what the doctor felt about that, because I've been researching it for a number of years.
Mm-hmm. Well, so the reason why this works is it all comes down to one of the important things is proprioception. So this is kind of even the idea of the barefoot shoes, is that instead of putting this stable shoe on your foot and you put more something that's barefoot, you start to, activate a lot more intrinsic muscles that are due to stabilizing and things like that. So one of the steps towards rehab, let's say we're rehabbing pretty much anything in the lower extremity, one of the last steps is making sure that the movement pattern is something that can be done with unsteadiness to increase that proprioception. So there are even other machines that exist that you can actually control how much vibration is created, and you get people to do different exercises. And we actually have it at the clinic, where you control how much movement it happens. So that's, I'm not very familiar with exercising in the sand, but I would assume that is the exact same premise, that it's just really because on the sand, it's not an even surface. The sand displaces as you move. It needs you to increase your proprioceptive ability to make sure that you're staying stable. And that lack of stability from the surface means that you're going to use muscles that otherwise aren't used. So is it something that's good? Yeah, it is probably good. I do think that, like everything, it needs to be graded. You can't take someone with an ankle sprain and say, after 2 weeks, get in the sand. But maybe that's the last step of their rehab, or a chronic or an acute low back pain patient. But it's interesting, but I think it's based mainly on the proprioceptive aspect where you're introducing an unstable surface.
Is it kind of like, I guess it'd be different than providing a little extra resistance, like doing stuff in water, right?
Yeah, and water is a little bit different. That creates like a lack of pressure on the joints, and so there's different things. I think everything out there is good. Again, it's just a matter of how I started the show. Is this right for this specific person or this other specific person? And that's the harder part to figure out.
Victoria, you'll wrap it up for us today. What's your concern?
So I've been suffering from endometriosis for God knows how long, and I was wondering if Dr. Luke can suggest anything to me, because it's basically affecting my life day-to-day.
Have you seen anybody about this, any specialists?
Yes, gynecologist, done surgeries, but so far, it's still there, and it's really, really painful.
Yeah. So this is, I guess, one of those examples of things that, I'm not really well equipped to deal with. I obviously know what endometriosis is. I've met a lot of people with it. If you've already been seeing specialists, then that's likely a good place to start. I specifically don't have any other recommendations that I could make. What I could suggest is call me off the air, and maybe getting a referral to one of the naturopaths that I work with that deals a little bit more with gynecological issues. Maybe working at it from that end, there may be something there, but I can't specifically myself say that there's anything that I can think of that could help that your specialists haven't already recommended. Okay. Awesome. No problem.
Thank you so much.
1-855-55 Dr. Lou.
It's just that easy.
That's just that easy, man.
Call me with your healthcare question. If it's something I can help with, I'm going to tell you. If it's not, I'm also going to tell you. It's just very, very simple.
Very simple. You're a simple guy.
Simple.
But you're a bright guy.
Thank you.
Dr. Lou, 1-855-55-DRLOU is the number. info@paincarecanada.com. Make that call. Do it now. We're wrapping for another weekend back here tomorrow, or pardon me, next Saturday. We could come tomorrow, but we'd have to kick someone else off the air. Back here next Saturday at 12 o'clock, Dr. Payne Show, Talk Radio, AM 640.